Hello, it's Anthony Chadwick from the Webinar Vet, welcoming you to another episode of VETchat, the UK's #1 veterinary podcast. And I'm super pleased to have Ruth Serlin on the podcast with me today. Ruth is a veterinary surgeon, has, as she described it, led a squiggly career, although I think it's a very interesting career, Ruth, and we'll go over that, and is a member of the Vet Humanities UK group as well. And we'll talk about what that is as well during the podcast. But first of all, thank you so much for giving up so much of your time to speak to me today.
Oh, thank you. Yeah, you're welcome. It's great to come on board.
You've, close to my heart, worked for a lot of the charities. I saw a bit of practice with PDSA and did a little bit of locum work fairly early in my career, but fantastic businesses to work for. I always talk about PDSA with great affection. And the one thing, apart from all the obvious things, was even at that stage that I really enjoyed, because I do like my breaks. They would close the door in the morning. They would close the door in the afternoon for 15 minutes. And, you know, because they could be very, very busy practices, but also you got your lunch hour. And I do think when I hear vets and other professions sometimes saying, I didn't have time to urinate today, there is something wrong with that particular place that you're working in. So that's a little shout out for the PDSA to start with.
Yeah, if you didn't have those breaks, you would become mentally quite fried. And it is a shame if we're racing around and we don't have good ways to manage our time. But from the system, when the system actually helps you manage your time well, that's really, really good. We used to go on a lovely walk when I worked for the PDSA by some woods. Yeah. So we walked with the dogs every lunchtime, and that genuinely would clear your head for the rest of the full-onness of the rest of the day.
And we're going to talk about, because I think, you know, your group has been very much responsible for one of the new buzzwords, contextualised care, which I love as a phrase, and obviously we'll talk about it in more detail. But I think if you are racing from pillar to post, from case to case, actually to reflect on the case, to have discussions with colleagues is very, very difficult if everybody's super busy, isn't it?
I think it is. And it's interesting that you talked about reflection. You know, as part of the contextualized care sort of concept, we want to talk about reflection in there because we're hoping that colleagues will spend a little bit of time in the moment or outside of the moment thinking about what their biases are and what's driving them and what's pushing them in the decision-making process that's happening. And so discussions with others, conversations with junior, senior colleagues, people inside, outside of the professions are vital to really help you understand who it is that you are and how you're operating in this system. So in those, if you're quite practiced in reflection outside of the heat of the moment, it becomes something that actually becomes a tool that you can use in the heat of the moment as well, I think.
Yeah, exactly. And obviously people listening or watching on video blog will probably be amazed to hear that we're of a similar vintage and qualified around about the same time. But, you know, you've spent a lot of time working within charity, but then also went to university, went to Royal Veterinary College, where you were working on veterinary professionalism. Tell us a little bit about how did that role sort of pan out within the vet school? Because I think it's another really important area for us to look at as well.
I was very lucky in a way. I started at the vet school working in the clinics, so being the leader of a rotation in one of the charities, so that's where it all connected. And then I got seconded to do some work with some communication skills, and I got really very interested in communication skills. I was always a word nerd anyway, so I was always interested in how we use words, how we use language. So I got very involved in the communication skills training and actually didn't go back into that charity rotation, and then moved into the sort of wider thinking around professionalism. And actually at the RVC, at that time, Liz Chan was doing her PhD on professional identity. And it was really, really interesting to think about. I think, once upon a time, we used to think about professionalism as normative behaviours or normative ways of presenting oneself. And time moves on and thinking changes. And it's much more now about how do you make the profession work for you and how do you work within the profession and how do you view the work that you do. So I think context is part of that as well. So actually, if some of the really interesting work that was done on that was, if we are flexible, adaptable, if we think about outcomes as being relationship based, if we think about good outcomes as being team based or relationship with a client based, that's a much more comfortable world for us to be in than it's just purely clinical outcomes of an animal. And Liz did a lot of work on that, and that was infused into the teaching that we did. And I think one of the big things for me was really trying to prepare students to live with uncertainty and trying to prepare students to accept that there are many answers. I'm going to quote my colleague Richard Green at the moment, but there are many answers and none of them are perfect, but just looking at which ones are least bad sometimes, and that was really, really important, that you could see that it's not just black and white.
Yeah, word nerd, coming back to that, normative. Explain that word to me.
Normative is really sort of giving a set of instructions on how to behave and how to be and how to present yourself.
Prescriptive, being very prescriptive, yeah.
We want you to fit into this box. This box is the vet box. This box is the vet nurse box. You need to fit into that box to be a vet and to be respected and to get on, And I think more and more we recognise that those people don't exist. They only exist in that box, and how do we have professions? How do we have our professions that accommodate people that don't fit into that box, but they're still part of the profession, and they're still doing a good job. So it's how do we integrate that thinking?
I thought it was also really good you speaking about, and I think you get this as you get older and mistakes are made and you learn from mistakes, is, the world is not black and white, it's mainly grey in pretty much every area, every profession that you would care to think of. And also the relationship element, just getting the animal well. If you don't have a relationship with the client, then it is going to be hard for you to have a satisfying life as a vet or a vet nurse, because you'll be bumping heads all the time, won't you?
It can be very, very frustrating. And one of the things that happen, and I see it more and more, and I think as we get more and more pushed with cost of living, with just the way that we are going at the moment, that I see a lot of veterinary professionals very frustrated with clients.
Yeah.
And it's like, when I'm teaching and training, I say, well, that client's your granny, or that client's your aunt, and that client's you when you're going to the garage or something. And so we can get quite, we feel the client's the enemy. And this was, really nicely done in that work by Liz Chan, was that the new grads that felt actually that wasn't the case and not really buying into that narrative and actually thinking, well, nothing's perfect. Nothing's going to hit that, I'm going to say the word gold standard, but nothing's going to hit that gold standard way of doing it. Every animal, every person comes with a set of unique circumstances that actually we've got to manage that as well. So once you get your head around that you're managing all the different circumstances, all the different factors involved, that sometimes treatment options look different for the same disease. And I think we've learned a lot. We've learned a lot about the diseases over the years, and now trying to come back into integrating the people, the environment, society, our wider profession, business, how do we integrate all of that into the decisions that we make collectively with the client?
If we can do that, it probably helps us with our own anxiety and stress and things, in that we don't take everything to heart. And I think it's having that holistic approach. I think you brought it up there really well. I used to talk a lot about triangles, when I was with the client, and I'd say, look, we're here together. There's myself, yourself, the dog or the cat, or whatever the animal was. There's three people in the room. Let's make sure that we really prioritize the animal. So I always said the animal was the most important. But then there was a partnership going on, and whatever decisions we came to were based around, the requirements of everybody. Because if somebody doesn't have £10,000 or £5,000 for that piece of surgery, there is always another option. And at the same time, we shouldn't also x-ray people's pockets and think that they can't afford something. So it's giving people information and being able to come together to make that decision. I now kind of talk more about a square than I do a triangle, because I bring the environment in, because, I'm very passionate about sustainability. And I think you listen to the vet schools and they say, well, we can't find more lectures space, for these subjects. There's so much that's getting taught anyway. And my attitude is always, again, if we teach it holistically, we bring it into, everything we talk about. Okay, what are we going to do about that waste? What about that drug that we're putting onto the animal that may contaminate the environment? Do we need to give it every month? Is that a product that actually we shouldn't use because of its environmental aspects? And so, I love the fact that you as a group have come together and are really pushing this whole concept of contextualized care, because without calling it that name, I think it was something I always tried to do, when I was practicing as a vet.
I love the fact that change happens. Like, you've got your triangle into a square. Well, we're finding it difficult to contextualize care, but we've got a sort of the thought of the triad, a triangle, and we've got the vet team and the caregiver team and the animal or animals, and then kind of around it we've got other things. So we've got other things like the environment, the actual environment physically around the animal, but the ecosystem environment as well. We've got business, we've got professional standards, we've got legislation, we've got societal perceptions. And I think what impacted me, and I've made a commitment as part of the carbon literacy training that I went on, and my commitment at the end of it was to always bring up the environment in contextualized care. That actually all of this is critical thinking. So it's really interesting that, having been inside and outside of the university, the space is pushed. But our job is to create vets and vet nurses through a vocational course, but it's also to create graduates that are capable of critical thinking. And critical thinking is looking at the different perspectives and the different ways of viewing the thing that you're doing or whatever else is going on, and looking at all those different perspectives and trying to prioritize, trying to work out a way through it. And I think it's very interesting that, when we talk about animals in our care, and this is me talking more than anyone else, but which animals are in our care? Are we just saying it's the animals in front of us right there and then? Is it the paying clients' animals, or we've got wildlife as well? But then which animals are the ones in our care, and actually are humans in our care to a certain degree as well? So, we can bring all of this stuff into the critical thinking. It makes it more complex, but it's complex anyway. You can't simplify it. It's complex. So accepting complexity, accepting uncertainty, and then being able to apply some critical thinking is, to me, much more nuanced, much more realistic about what it is that we do, as opposed to saying we've got to do this particular procedure or we're not professional, or, the professionalism is in the problem solving and the critical thinking.
Yeah, I think it's, as we said before, life is grey.
Yeah.
And actually, if you have a very dogmatic approach to things, that won't work long term. And I suppose, Royal College has brought in reflective learning and been a bit lambasted for it. But I think there's lots of vets and nurses who do that naturally. I mean, I never had a problem with it, because I feel that if you learn something, the best way of learning is when you then apply it to a situation. I always use, there's a lovely testimonial we got from a veterinary client who was struggling with a feline diabetic case, a cat with diabetes. And he went back and looked at 2 or 3 of our webinars, reflected on all of that, made some notes, went back to the clinic, changed a few things around, and then that cat was being really well controlled. And so there's so much learning in that, so much reflection. And that's how you become, a better vet, because you're struggling with a case and then you put some time into it. That's the best possible CPD.
Yeah. I really, I like what you said about, or I was interested in what you said dogmatic. And it's, again, we crave certainty. We all want it. Everybody wants, well, what do I do? What's the right answer? What's the wrong answer? Right, I'm going to do the right thing, because that's what we want. We humanly crave a certainty. And so being dogmatic when we're in an uncertain space, there's an incongruence there. There's a disconnect. Yeah. And I think that's part of how we can get dug into positions. I mean, God, I've done it. I mean, anyone that knows me will go, what's Ruth talking about? She's the most dogmatic person I know. But, just being able to move in and out of, well, what if I thought about it like this? What if I thought about it like that? What do other people have to say? What's the eminence opinion? What's the evidence? What do other people talk about it? And when we talk about evidence-based medicine, it is about integrating that into the reality that you're faced with, but taking different positions on it and then thinking about, so how can I approach it differently? Or does my approach now feel a lot more comfortable to me? Or is there another approach? And I'm going to add on to that reflection more and more about, also then, what does it say about me that I need that position? Or am I able to be a person that just comfortably lives in this space where it's a bit uncertain, but I've got a plan that feels okay, that we're all involved in. So the dogmatic, I think, can be incredibly, we need it, we want it. It constrains us, and it also impacts us mentally, I think, as well. Because if things don't go the way that it should have gone, it's very hard for us as people to just go, oh, okay, that didn't work out. Now what? How curious, as opposed to, I should have done this, or somebody else should have done that, or it's your fault, or it's my fault, or it's, that's a much easier position to get into, as opposed to, oh, that's curious. Right. Okay, let's think about it some more. So reflection,
I do like a bit of uncertainty. We've tried to do it with the Veterinary Green Discussion Forum, where it's very much, discussion and listening. And actually, when you listen to people who maybe have slightly different opinions to you, that's how you begin to understand people more, isn't it?
I think so. When I'm doing my communication skills stuff, I ask people, what's the most important communication skill? And sometimes people say, oh, clarity, or, whatever. And it's like, it's listening. We all find it difficult. Some of us find it more difficult than others. But actually, when you really do listen to someone so that you can actually understand, not disagree, not just chip in, just so that you can listen, so that you can really understand what's going on for that other person and understand their position, you get a whole new perspective on the thing that you might be feeling dogmatic about, or
Mm.
you might be feeling uncertain about. And I think it's lovely to be able to do, and it's a skill that we can learn, we can hone, we can flex it.
Yeah, I remember reading about listening in Chinese symbols. It's all about listening not only with the ears, but with the brain, the eyes, with the heart as well. So it's listening in its entirety,
Yeah,
using all of our senses, even our body language. If I'm listening to you, but I'm sort of looking at, and I occasionally do this when I'm doing some of the podcasts at home, I have birds on the bird table. So there can be a distraction when I see what's landed on the bird table, but immediately I'm taking some of that listening away from, it's hard. It is hard to multitask, isn't it?
well, actually, this is so interesting, because I think you're right, and it can distractibility can impact our listening. But I don't think we can always assume that somebody, this is one of my, I'll go down a little rabbit hole with you, but I don't think we can always assume that somebody's not listening if they're not looking at you. Because one of the other things that I'm really interested in is how neurodivergence impacts communication. So there will be a bunch of kids sitting in a school right now in trouble because they're looking out the window and they're not listening to the maths. But if the teacher asks them to repeat the maths, they'll go, yeah, da, 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 and they can't listen and look. So this is, our understanding of the world and the way people move in it and the way people behave in it changes. So
that's a good point.
Yeah, and I am eminently distractible. And so I have to work very hard to come back into a point, come back into listening. So, I have to ask people to forgive me if sometimes I'm, look, a squirrel. But listening truly, and listening with your heart, with your brain, with your ears, listening into that other person's thinking is just fabulous. It's just fabulous. It's like I said earlier, that almost every conversation that I have, particularly about contextualized care, but other stuff, is listening to other people's position on it, listening to their take. And I always go, oh, that's interesting. I'm going to write that down, take it away. And it becomes part of a bigger whole.
Well, we end up, our learning, our curriculum, once we leave vet school, we create our own curriculum. And actually, as you develop all of those learnings from all different people, that creates the uniqueness of the person, because none of us have exactly the same experiences, do we? So we all look at things in slightly different ways. We are a sort of product of our time and how we use that time, aren't we?
Yeah. Yeah, and that's, I think, coming back into that identity, the professional identity, is how do we integrate ourselves and roles? How do we integrate? And it's complex, it's nuanced, and we are all individuals, and we all need to thrive. We all need to feel it's our profession.
But we want that diverse profession anyway, that inclusive profession that accepts, because different people bring different skills into the profession, don't they? I've kind of always like to look outside. So I'm this week I'm going to a waste management conference. Again, there's probably not many vets that go to that. I know you've done a applied linguistic masters, which I'd love to maybe talk a bit about now. But we have in the past been in danger of being a little bit of a conservative profession that spends a lot of its time looking at its navel. And, indeed, the webinar vet came about because I went to an internet conference, heard about webinars, and thought, why are we not doing this in the profession? There were established education companies who were quite happy with the face-to-face model. And of course, there's so many advantages to face-to-face, but it was stopping some people doing their training because of the expense and the difficulty of, going to face-to-face as well. So adding that extra element of virtual learning, I think, has been a real benefit, for the profession. So people now going outside, I think, brings riches back into the profession, doesn't it?
Yeah, I agree. From my education background as well, it's we can learn in different ways, and we can learn. And I think you're increasing the accessibility and you can learn around your daily life. You can, do a webinar in the evenings, first thing in the morning. You can listen to it while you're running, driving. You can, if it's difficult for you to leave your house, you can, Now we've got telemedicine as well. So, it's the world has opened up. The world has opened up, and it's a very different one from the one that you and I qualified in. But that's brilliant. But the applied linguistics thing for me was I was looking for a way of thinking about communication and a way of researching it, again, because I was kind of a little bit, there seems to be lots of stuff that gets applied in certain ways, and again, a sort of normative approach to communication. And I was thinking, well, I'm always the one that tries to look underneath and behind and around and go, how does that work? And I always take things to bits. I can't always put them back together again. But I wanted a way to think about how to take interactions to bits. And so I found a research method that I thought, oh, this looks great. So this research method, I'm going to blow your mind with the name of it. It's called conversation analysis. So you can guess what it does. It analyzes conversations. But the beauty of conversation analysis is it looks at it from the people involved in it, and it looks at one turn influencing the next turn, and the next thing being influenced by the thing that went before and influencing the thing that goes next. So it's a way that people weave conversations together. And actually, the research tells us that conversations actually look quite similar, or there's patterns to them. So this research technique, I thought, I'm really interested in that. And then I realized that I'd have to not just look at that, I'd have to actually look at a wider whole. So I thought, I'm very, pleased that the RVC supported this. But I did a master's in applied linguistics, which really is looking at how language works in society. So it's that bit of linguistics is one thing, or language is one thing, but how do we use it? It's like the structure and function of language, really. And it's about written texts, it's about spoken words, but it's just really digging down into it. It's more of a method. So it's more of a way of looking at things. So it might link into psychology or sociology. I was in the School of English at Nottingham, so it was a very humanities-based approach. But it's just a way of looking at how we communicate and, how it all pans out. And the stuff that I was really interested in, and how do people have conversations together. And the institutionalized conversations are different from the friends conversation, which is different from the family conversation. And how does power play out across those conversations? And how do we do what it is that we do through these interactions?
What are the maybe three asking a difficult question, but what are the three take-homes that you took away from that master's that could apply or would be useful to apply in a veterinary, in any context, but particularly a veterinary context?
This is one of the things that I talk about when my dissertation was on euthanasia consults. So a colleague and the clients, this was just such rich data, but I was allowed to, they taped euthanasia consults and I listened to them. I had 5 of them because the conversation analysis, honestly, I could write 4,000 words on 6 lines, really. It's a very, very detailed micro-analysis. So I had these beautiful euthanasia consults to listen to, and I'd done so many of them, but I'd never really looked at them from the outside. So I was now an outside researcher looking in, trying to work out how do people do this thing that is actually quite a tricky thing to do. Euthanizing a pet, taking a life. How do they do it and manage the emotions in those conversations? And also so that, it sounds a bit dramatic, but just so that the fabric of society isn't ripped by somebody asking somebody to do something and this thing happening. So I was really interested in how those conversations played out. And it was just so beautifully done. They were such amazing conversations. And I've got a real concept of the structure and things that need to happen in those conversations for them to work. So, for example, really the clients usually want to tell a story. They want to tell you a story about the best pet. This is the best dog because this dog did this. And so it's going to come. So let's listen and let's wait for it. Let's ask for it. It's there.
Yeah.
We also have to have a little bit of time of making the euthanasia warranted. So making sure that everybody has a conversation in which we come to an understanding that this is an okay thing to do. And I think if we don't have those conversations, it gets very tricky. And there's a lovely play of power of rights to knowledge and who's allowed to say this is bad and who's allowed not to. And it's played out really very, very subtly across these conversations. So I think understanding, I mean, just going macro now, but understanding how communication works, understanding that nothing is there accidentally, everything is there for it's doing something. Words do something. Phrases do something. And what is it doing in this conversation? So understanding how those conversations work mean that we can manage them better when we're finding them challenging. We can think about what it is that we are doing, what works, what doesn't work, and how to navigate those conversations. So, that's one of the things that came from the masters was just, this is so, it's a delicate dance, these conversations, all of them really. There's a lot of really brilliant work in the medical field around conversation analysis, virtually none in the veterinary field. There's a couple of beautiful papers talking about where vets and vet nurses talk to and through the animals. So they try and educate clients about animal behavior by comforting an animal who's doing something, which is beautiful. Yeah. It's just how we use language and what the impact of it is on the other person and how those conversations play out. But there's not much CA work in vet. There's quite a lot in human medicine, and it's really fascinating. It's some really, really interesting sort of work being done on how we make decisions, how that's framed linguistically across decision making with patients. There's a beautiful one where there's one word can make a huge difference. So if you ask a client, or this is a patient, but if you ask a patient, is there anything else? That question is created, and it's easier for people to say no. No, there's nothing else you need. Yeah. It's just the way that question, it creates the next bit, and the next bit is the patients usually say no. If you say, is there something else you'd like to talk to me about? People are much more orientated to say, yes, there is something. So they did an RCT, they did a random controlled trial on something and anything, and found that more unmet needs were brought up by the word something, because it's just, when we do things, and when we create, when we talk, when we interact, we create space for the next thing to happen.
Yeah.
And we can tilt it so that it's easier for people to say yes or no. We can, knowingly or unknowingly, but it's just recognizing that, we're creating space around us, and what sort of space are we creating? What sort of communicative space is happening?
Ruth, I think, the art of the euthanasia consult is probably a full podcast, probably a webinar as well, because it's such I always felt very blessed to be involved in those, because it was a privileged position to be in with some of these treasured pets, and such an important part of the job that we do, because there's loads of work now done on, if an animal is euthanized in a room, even if it's done well, they perhaps will never come back. So there's all the sort of positioning of where it happens as well. But we will definitely come back and do that as another podcast or a webinar if you're up for it.
Yeah, I'm up for talking about euthanasia all the time. We don't talk about it enough. We do it all the time. It's something that, I'm
very up for that. I'm conscious we've come to the end of our time, but it's been so lovely to speak to you and hear all about the contextualised care, almost from the horse's mouth as well, if you pardon the pun. So, really, really enjoyed that. And, good luck with the rest of the work that you're doing in this very important area of communication, with clients, within the team. Talking and listening is such an important part of our jobs, isn't it?
Yeah. Oh, huge. And I think this is one of the things you said before, and both in my experience of teaching educators to teach and thinking about how we behave as vets and vet nurses, that whole thing about filling silence. We fill it, teachers fill it when they feel the classroom's getting, or the lecture theatre or whatever it is they're doing gets a bit out of control. They start talking. We talk into silences. And I think, just actually a little bit more silence, a little bit more listening, a little bit more asking people what's going on for you. When we talked about the contextualised care, that shared decision making is what matters to you here, what's important to you in the decision that we're going to make. And then we'll take that into consideration as we move forwards, not pushing our idea about what's best. So, thank you for having me.
Thank you so much, Ruth. Thanks, everyone, for listening. I hope to see you on a podcast or a webinar very soon, and enjoy the rest of the day wherever you are. Take care. Bye-bye.